Hello, my name is Bethann Santangelo, and I'm doing my informative speech. The topic that I've chosen to discuss is the topic of cardiovascular disease. I'd like to discuss signs and symptoms of a heart attack and signs and symptoms of a stroke, and discuss some risk factors that you can avoid and hopefully prevent getting cardiovascular disease. According to the National Institute on Heart, Lung, and Blood, cardiovascular disease is the #1 killer of men and women today in the United States. I will tell you that it personally affects me in that my mother died 2 years ago from cardiovascular disease, and I'm glad that I have this opportunity to spread the word. The CDC states that 1.5 million people die each year from cardiovascular disease related deaths. That comes out to be 30 deaths every hour from cardiovascular disease, so it's pretty significant. If you look at this pie chart that I have, you'll notice that more than half of the pie chart is related to cardiovascular related illnesses such as sudden cardiac arrest and stroke, when the other half of it is just single digits that such as cancer and HIV, homicides, and traffic accidents. So it is significant in our mortality. I will tell you that signs and symptoms of a heart attack can be many things, but chest pain being the #1 thing. You also can experience sweating, vomiting, nausea, a cough. You can have extreme anxiety, feel faint, and unfortunately have even mild symptoms such as flu-like symptoms. Any of these symptoms should be immediately reported to a healthcare professional. You should call 911. Time is of the essence. The quicker you get to the hospital and get treated, the less of a heart attack you will have. Stroke signs and symptoms can be remembered according to this acronym, FAST. F for facial drooping, A for arm weakness, S for speech difficulty, T for time to call 911. Again, you find your grandmother with a facial droop, or she can't move her arm, drooling, unable to speak, call 911. She may be having a stroke. Risk factors that we can not change are the fact that as we age, we do get more susceptible to having cardiovascular disease. Also, men have a greater chance of developing cardiovascular disease than women. And if you have a family history of cardiovascular disease, there's a pretty good chance that you will get it as well. Risk factors that we can change are, if you know that you have high blood pressure, you need to avoid salt. You need to follow up with your physician, maintain your blood pressure within a normal level. Anything greater than 140/90 is considered high blood pressure. So if you need to be on medication, you need to take your medication, you need to follow up with your physician and make sure that you get your blood pressure checked and that it remains in a good level so that there's not a lot of strain on your heart, because that's exactly what it is, pressure on your heart. Another thing is no smoking. Smoking is a very bad thing for the cardiovascular system. Nicotine increases the pressure within the system, and 10% of all cardiovascular related deaths are related to smoking, as per WebMD. If you have diabetes, maintaining your blood glucose within a normal level is very, very important. This stops the plaque from coming. This means you need to follow up with your physician. It means you every day check your blood sugar, make sure that you're on a healthy diet. We all need to be on a healthy diet. Avoid high cholesterol foods such as fatty foods, no fried foods. Avoid burgers, no McDonald's, no Wendy's. We need to eat fresh fruits and vegetables, nice salads, fish and chicken. Cholesterol, if you have high cholesterol, you need to watch the cholesterol intake. Don't eat these greasy foods. If you're on cholesterol medication, take your medication regularly, follow up with your physician, and get your cholesterol checked. Make sure that we're physically active. Go for walks, work out at the gym, do what you can to keep yourself active. Physical inactivity is one of the main causes. It's the fourth leading risk factor, as a matter of fact, for cardiovascular disease as per the World Heart Federation. And we really need to, watch our weight, don't be overweight, and don't be obese, and this will help out with your heart, won't have to work so hard. So you've learned some prevention techniques. I'm glad that I could spread the word. I'll give credit due to the CDC, WebMD, American Heart Association, the World Heart Federation, and the National Institute of Heart, Lung, and Blood. I have listed on my comments section where I submitted this report some information if you want to go back over the signs and symptoms of heart disease and stroke, and also some of the links to find out some of these agencies that also may help you find some information on preventing cardiovascular disease. And I do hope that this helps you, and I hope you live a long life. I can tell you that my mother, here in this picture, when she was a teenager, never thought that she would die from heart disease. And here at her birthday party, never thought that this was her last birthday, all due to cardiovascular disease. Now that you've learned some tips and hints on how to avoid these risk factors, I hope you take them with you and have a nice longevity. Thank you.